Are you a sports player and you're thinking on how you can manage your ankle sprain? This video is for you. So I'll tell you how you can manage your ankle sprain. Let's go from number one. Number one thing you have to do for me is to give a proper assessment. All right, you take assessment. Let's know how this ankle sprain is occurring. What is the duration of this ankle sprain? If it's before 24 to 48 hours, like you're playing the game now, it happens in the short time before for 24 to 48 hours, know that it's acute. And if it's above that, then you know that it's chronic. So there's two ways we can manage it. So if it's acute ankle sprain, what can you do? Acute ankle sprain, then you check, you examine it again. If some issues are coming from the superior joints, like the knee joint and the hip joint, because those issues can still cause the issue to the ankle. So if there's no issues from there, then we are good to go with my technique, which I'm teaching now. And at the same time, what you have to do for me is to check if the pain is radiating. All right, if there's no issues in the other superior joints, check if the pain is radiating, because some pains just radiate from the lumbar plexus and they are coming down to the ankle. So if it's radiating, then there is huge issues that you have to decrease the radiating pain so that you will get the achievement and the goal in your ankle sprain. And another bonus I'll be giving you at the end of the video is how can you prevent this pain from coming back. It's something called the reoccurrence of pain, because most times after the management, patients, they have this ankle pain again. So at the end of the video, I'll be telling you this. So once the assessment is done, let's say for example you're having, number one, we're having 24 to 48 hours pain. All right, then what can you do? You can use the ice pack. All right, put in the place of the pain. Then the ice pack is blocking the sensation to the brain, which is causing there will be no pain. You feel no pain after using the ice, but though if you're still walking, you still feel pain, but the pain will decrease drastically. All right, so what you have to do after the pain has gone down is to do strengthening exercise, not just the ankle. You do full joint strengthening exercise, like in a squatting exercise, or you can do agility kind of strengthening exercise. Agility will be so severe, but you can do some strengthening exercise from the quadriceps, from the combination in a close kind of chain strengthening exercise. All right, so you're not just doing strengthening exercise just on the ankle joint. All right, especially athletes. But before we go to that strengthening exercise, my bonus here is that if you're having ankle sprain and you've decreased your pain, all right, let's say you're using, it's acute ankle sprain, all right, you're using ice pack, you decrease the pain today, and tomorrow the pain, it's little pain will still be there. Continue tomorrow decreasing the pain. But one thing I want you to do is to decrease the soft tissue, like release the soft tissue. All right, you can release the soft tissue by performing MFR. In my next video, I'll be telling you what is MFR, how to perform MSR. MFR means myofascial release. All right, you can use your thumb, put in, especially in the soleus muscles, in the tibialis anterior, tibialis posterior, in the gastrocnemius muscles, in the flexor and extensor iliacus muscles, in those areas of the legs. All right, the tibia aspect. All right, you can just use your hands and you try to decrease, and you're pushing, if possible, if you have a gel, you put on the leg so that it will be, you can make a fist and you're scrubbing like this, but you're not pushing this way downward. You're pushing from the ankle joint. Let's say this is the hand, this is the ankle joint. You're pushing to the superior, to the knee area. All right, you're pushing like this, you're dragging it like this. All right, you go to all the muscles. So it will, if the muscle is very tight, if there's too many tension on the muscles, then it will help decrease the muscle tightness, and this will help prevent injury reoccurrence. And remember, other technique of preventing injury reoccurrence I'll be explaining in my next video, like warm up. You have to do warm up before you practice so that you won't have issues and etc. All right, those are very essential. All right, thank you for watching.